We can provide effective, safe, sustainable medicine to the public. We have the intelligence, technology, and skilled personnel to make our nation and our world brilliantly healthy. As we benefit humanity, humanity benefits the planet. The wellness of the populace directly relates to the wellness of our habitats. We must create a world of abundance, peace, and prosperity. By influencing public policy, treating patient populations, and expanding the narrative of an interwoven health environment, we support a system of sustainable medicine. Allies in creating sustainable medicine must work towards a number of syncretic goals. Achievements in one sector will have magnified downstream impacts on others. Moreover, sustained efforts to create concepts, memes, and public discourse will empower the greatest change. For the problem lies not so much in a failure of logistics, as in the failure of the social narrative, the failure of our democracy, and the growing rift between man and nature. Integrative treatments. Medical outcomes improve greatly when combined with functional and integrative medicine. Patients must access health coaching, acupuncture, massage, chiropractic, and other traditional modalities. The providers must be well paid within efficient systems. Integrative treatments shore up the current gap in medical care, providing patients with meaningful face time with their practitioners and effective methods to speed recoveries. Facilitating and adding more integrative treatments nourishes the wellness of the public at a relatively small cost. Revamping costs in MD systems. Price gouging and a profit-motivated industry cause medicine to be beyond the finances of billions of people. Although recent programs seek to remedy this problem, they fail to check or limit the profiteering of corporations and instead provide guaranteed subscriptions to HMOs. Any serious move toward an equitable and effective medical system must focus on price and profit limiting. We must reduce the cost of running a practice for MDs. Many general practitioners and even specialists are going out of business because of the extremely high overhead. The majority of MDs are forced to offer only 7 to 12 minutes to each patient and cannot listen, interact, or form holistic treatment plans. MDs are capable of creating much better patient experiences if given the financial context in which to do so. Moreover, medical practitioners must be incentivized to heal the patient rather than to loop the patient into ever more expensive interventions. This endless cycle of profit fills the coffers of hospitals and HMOs at the detriment of human health. Interaction with all life. Human health is suffering because we are removed from nature. We are inside, protected, cooled, heated, and walled off from soil, animals, plants, fungi. Humans thrive when living in an interwoven whole with all other species. People must go outside walking, hiking, biking, and boating. They must cultivate gardens and trees and have personal interactions with those beings. We must get humans back into nature and help them release their fear of the wilds. Familial lineage traumas. To truly heal, we must heal not only ourselves but our family lineages. Traumas go from one generation to the next. If you know your parents, they often subconsciously deploy these traumas onto you. But even if you don't know them, the traumas are still in your genes, in the propensity for diabetes and other inherited disease, in the functioning of your nervous system. Once again, by healing individuals, we help them from perpetuating family traumas. But to get to the root of deeper lineage pain, we must get people visiting the graves of their ancestors with proper offerings. We must safely integrate shamanic ceremony from multiple traditions, which releases inherited pains and prevents their passage to progeny. We must actively face our racism, the worst form of which is against oneself. Internal colonization perpetuates deep wounds. All human beings are worthy and beautiful. Social justice must expand so that society offers equality, dignity, and respect to all races, genders, religions, ethnicities, and economic backgrounds. Clean and affordable housing. Unsafe living conditions are responsible for so much of disease, from mold to improper heating or cooling, to toxic materials, to simply not being able to afford adequate shelter. Housing is a key to health. We must take a look at the basic paradigm of housing for profit and shift into a housing as a human right. Our society possesses more than enough building materials and even enough already built homes to house everyone. But we have millions of people homeless because of a mortgage scandal, and tens of millions more who pay excessive rents and can't get a leg up financially. Housing must be available to all. We must change our building codes and laws, promoting the construction of clean, dry homes via sustainable building materials like cob, straw bale, bamboo, and locally sourced wood. As humans are safely housed without fear of being kicked out, they can truly embrace the healing process. Living wages for workers. Poverty is a major cause of disease. In the US, you have to be in the upper middle class to afford a safe, clean neighborhood, organic food, a quality education, or even adequate police protection. As these basic standards are literal requirements for good health, it means that the vast majority of our people cannot maintain their wellness. We must examine financial inequity and correct the injustice that is inherent in our system. The current model is totally arbitrary. It serves only to enrich the few at the expense of the many. Living wages and other financial balancings are crucial to creating human health, so long as the basic building blocks to health have to be bought and paid for. Success via biomarkers, an algorithmic approach. We can calibrate and optimize our plan for public health by using studies and scientific data. Current data shows that our medical system is failing to improve things like the incidence and mortality of cancer, heart disease, and diabetes. Thus, when we begin to actually lower those statistics, we'll know that we're succeeding in our goals. We can then strive for greater efficiency within even more important criterion, such as health span, meaning the amount of years of life while being truly healthy, and human happiness. Please like and subscribe, and please check out my book at Amazon.com, The Path of Man, How to Be a Hero. Thank you so much.